Breast cancer is one of those cancers which can be detected early and which has a recommended screening program also. Apart from the routine mammographic screening, which starts at differing age depending upon the risk of the lady, there is something very simple which can be done by every lady, which is breast self-examination. It is very simple to do and is free of cost. So I will divide this into three parts. Why do we need to do it? When do we do it? And how do we do it? Why is very simple to answer, because we can detect breast cancer or abnormalities in the breast early and get ourselves treated very well. It is a very simple procedure, takes only a few minutes of yours once in a month. When do we do it? Every lady should start at the age of around 20 years. Do it once in a month. The right time to do it is approximately 7 to 10 days from the beginning of the menstrual period. So if a lady begins a cycle on 1st of a month, then the best time to self-examine is between 7th and 10th of that month. For a lady who has attained menopause, they can fix up a day or time of the month. So first Sunday of the month or first day of the month can be fixed for self-examination. Now coming to how do we do it? We must do it in 2-3 parts. First is to inspect your breast, and for that you need to undress up to the waist, stand in front of the mirror, see for the symmetry of the breasts. Usually you may find one of the breasts slightly larger than the other one, but that's a normal variation and should not worry you. After that you need to raise your hands up to see if there is any change in the symmetry, if one of the breasts is getting pulled inside, and then you bend forward, again see in the mirror if there is any change in the symmetry. After having looked at your breast and nipple position, you must proceed to feel the breasts. And the best way is to use 3 middle fingers and flat of the middle fingers. You don't poke and you don't pinch, otherwise you will either miss the lumps or you will unnecessarily feel lumps and get worried, which are actually not lumps. So flat of the middle 3 fingers, slowly rolling on the breast tissue against the rib cage, covering every part of the breast slowly. It will take almost 5 to 7 minutes to examine both the breasts slowly. Then after that, once you've examined your breast, you also need to examine both the armpits and lower part of the neck just above the collarbone, because sometimes lymph nodes get enlarged which are affected by cancer from the breast. And finally, you need to check your nipple as well as if there is any nipple discharge, what is the color of the nipple discharge, which side the discharge is coming from, whether it is only one duct or there are multiple ducts. This will complete your self-examination. I would recommend that you see some breast self-examination videos which are there on YouTube, some human models who are showing it, and some animated videos. Yeah, breast cancer is treated by surgery, chemotherapy, radiotherapy and hormone therapy in various combinations. Not all patients would require all of them, but some of them would require all 4 of them. And surgery is one of the most important treatment of breast cancer. Over last 1 century, it has undergone a sea change from maximum tolerated treatment to minimum effective treatment. That is what we do now. It used to be radical mastectomy, which means removal of breast and also the muscles of the chest wall, which used to give a very bad scar, very bad cosmetic as well as functional outcome. It changed to preserving the muscles and then finally preserving the breasts. But then just preserving the breast may not be enough all the time, because sometimes we may have to remove a large part of the breast, which gives a very bad cosmetic outcome. So then came oncoplastic breast surgery, the concept of amalgamating plastic surgery and oncosurgery together, by which what we do is we reshape and remodel the breast if only a small area has been removed, so as to give a final outcome which is good and acceptable and is symmetrical to the opposite side. Sometimes we remove a larger area, then we have to bring tissue from some other part of the body. And at other times, we may need to remove the breast and can reconstruct using our body tissues only, or a combination of body tissues as well as artificial implants from outside. So these are various ways in which surgery has changed, and we are able to provide breast conservation surgery to 60 to 70% of our patients nowadays. Many times patients come with very advanced disease when you see it first, you say no, you have to remove the breast, but then we give chemotherapy and decrease the size of the breast, and if all other parameters are suitable, we are able to conserve those breasts as well. There have been examples of patients who are very well aware. I just spoke about early detection, self-examination. We have had patients who have self-examined, have come very early, in a very early stage to us, or even those patients who, because of their family history, were very aware and got themselves screened by mammogram. They found cancers even at stage 0, which is a pre-cancer stage, and where we can't even feel the lump. But there are technologies to find those lumps during surgery. We put a wire under ultrasound or mammographic guidance which goes to that lump or abnormality. Then along the wire we go during surgery and remove that area of the abnormality. In such patients, the cosmetic outcome is also good. They most of the time do not require any chemotherapy. Sometimes, very rarely, they may even avoid radiation therapy. And then very good outcome. Most of the patients are cured of their disease. That's the beauty of early detection of the disease. But surgery is not the only treatment. Breast cancer requires involvement of multiple disciplines, not only radiation oncology, medical oncology, but nuclear medicine, pathologists, radiologists, psychologists, plastic surgeons. So there are multiple specialties involved, and we need a good coordination. Apart from this, we also have breast care nurses who do counseling of our patients, who take care of their post-operative period, who teach them exercises, who follow them up for lymphedema. And lymphedema is basically swelling of the arm, which can happen when all the nodes are removed. So around a quarter of ladies after lymph node removal may develop lymphedema. So nurses would counsel them how to prevent it, what are the precautions to be taken, and if it happens, how to detect it in time and get treated. One more part of conservation which I would like to mention is about lymph nodes. There was a time when we used to remove all the lymph nodes in the armpits if there was a cancer in the breast, but not anymore. Researchers realized that many a times these nodes which have been removed are not actually involved by cancer. So developed a technique called Sentinel lymph node biopsy, whereby we remove only a few nodes which are the first station node of drainage from breast. So if those nodes are not involved by cancer, the chance of remaining nodes being involved by cancer is less than 2%. In many patients, we are able to save, by doing sentinel lymph node biopsy, a full lymph node removal, and thus we also save them from developing lymphedema or swelling of the arm. Thank you.